The 2024 National Oncology Symposium and annual general meeting on the Nigerian Cancer Association was held at the Nigerian Air Force Center, Abuja, on the 1st of November 2024, which culminated in a gala dinner and award night at the Nikon Hotel, Abuja. The theme of the conference was Bridging the Gap, Integrating Prevention, Advocacy, Research, and Treatment for Holistic Cancer Control in Nigeria. There was also a panel discussion during the town hall meeting titled Fighting Cancer Together, Integrating Public Awareness, Quality Treatment, and Survivorship Program. The 2024 town hall meeting and National Oncology Symposium was preceded by a 1-month Breast Cancer Awareness Month known as PINK. Usually October every year is Breast Cancer Awareness Month, and the theme for 2024 was No One Should Face Breast Cancer Alone. There were several media engagements to address this very important topic. The keynote lecture was brilliantly delivered by renowned hematologist in oncology, Professor Moise Drosimi, and the panelists for the town hall meeting were Dr. Benga Kodibola, Ambassador Kemi Adikeye, and Dr. Mustafa Aisha, and Dr. Dozie Kuniwambi. The Executive Governor of Benue State, His Excellency Reverend Father Dr. Sean Ilea, and the Executive Governor of Katsina State, His Excellency Maladiko Umaru Rada, and Executive Governor of Ekiti State, His Excellency Biodun Oyebandi, were honored with award of material service to humanity for their great strive in cancer prevention and control in their various states. Observations. The Nigerian Cancer Society observed the increasing incidence and time trend of some neglected cancers in Nigeria, such as childhood, ovarian, colorectal, and hematological cancer in Nigeria. It became a major concern to stakeholders in the space. In the past, people have thought that only breast cancer, cervical cancer, and prostate cancer are major cancer. But results from our cancer history across the country, is now indicating that some cancer that government policy, government agency, and etc. have been ignored over the years, are actually very important. And those are childhood cancer, ovarian, colorectal, and hematological cancer. They call cancer. I'm from a village in a rural community, and I know that I know what happened at that community level. If there was some community, don't know about something about cancer. I was in my state, in the rural community there in Kogi State, and somebody asked boy, and they call it boy, and where my attention was called to it, I went there and was called that he has, breast cancer. And I was told that his mother also died with that boy, some years ago. They are calling breast cancer boy. So that situation in the country, that the information dissemination on cancer is not getting to the rural community. And that is why you have both Nigeria, actually decided. The Nigerian Cancer Society greatly commended, the involvement of some states and private sectors in the diagnosis and treatment of cancer. However, lamented the poor support, being received, by government to support, particularly the private sector in this regard. Some states are taking up this challenge, and that is one of the major problems we have in Nigeria. The state government and local government have this mentality that cancer prevention and control in Nigeria is the responsibility of the federal government, and that is not correct. The federal government is doing a lot, but in most states in the country, there is nothing happening there. Only very few states, like Benue State, Ekiti State, Kebbi State, Kano, that have serious, program put in place for cancer prevention and control. So it's very important to, sound very clearly that it's not only the responsibility of federal government to intervene, in the mess of cancer that we have in the country. We must, the board also commend very greatly the management of Benue State, Benin University Hospital, Benin City, Edo State, and also Lagos State Teaching Hospital, there Lagos, for their giant strive in establishing STEM center, STEM state transplantation in Nigeria. It is worthy to note that these are the only STEM state transplantation in the entire West Africa. I must commend that, those two centers, hospitals for that. The society also noted the new initiative by African Hepatopancreatobiliary Cancer Consortium, Nigeria Cancer Society, Society of Gastroenterology and Hepatology in Nigeria, Federal Ministry of Health, and NICRAT to establish the first liver transplantation center in Nigeria. The NCS also expressed, with great worry that Nigeria is already expressing catastrophic, health resource for health crisis due to current migration of medical, and dental practitioners and other staff, known as JAPA syndrome. The conference further observed that the current brain drain has contributed, but not limited to poor remuneration, poor infrastructure, low standard of living, and inadequate funding, for healthcare system, particularly cancer research. Most institutions, for example, there's no oncology there. In several institutions, you have only one person as oncology. In some departments, you have your hospital, you have only one person as pathology. The oncology nurses are not there. In fact, in most, private hospitals in the country, you don't have oncology nurses. You don't have, onco pharmacy. The little that we have in the country have migrated to outside country. Therefore, making, management and treatment of cancer patients very cumbersome and difficult in the country. There's burnout syndrome by the physician, and health caregiver, because of that. The Nigerian Society also observed with great displeasure that Nigeria is already in serious catastrophic economic crisis, as evidenced by dramatic surge in consumer price, unbearable high cost of chemotherapy drug, instability in exchange rate, increase in number of multi-dimensionally poor Nigerians that now exceeded more than 150 million, according to World Bank data. Complete obsolescence of middle class and heightened extreme hunger and suffering in the land. And this have also affected our cancer patients. Many of them do not have money to come for their follow-up. Some of them stay in rural area, they cannot afford transmission money. Even cost of drugs is beyond most of those patients. And that's actually contributing to high mortality of our cancer patients. The society also expressed dismay with the strategic exit of some pharmaceutical giants from Nigeria, with consequent drug shortages, geometric increase in prices of their drug, and increasing unemployment. The concern further noted that this exodus raises serious concern about the future of access to essential medicine for millions of Nigerians, especially those diagnosed with cancer. The society, however, commended the federal government for the plan to construct 6 new cancer healthcare centers within the period of 3 years in Nigeria. But it's important to note that this is grossly inadequate for a country with over 200 million. The current projection in the country, is that also coupled to that, also number of radiotherapy facilities that also have in the country. Out of moment we have only 13 serving the population of 2 million. That is also grossly inadequate. The Nigerian Cancer Society, commended, NICRAT and also Federal Ministry of Health for the positive cancer control effort over the years, especially the establishment of National Cancer Asset Partnership Program that we know as NCAP, the Cancer Health Fund, CHF, introduction of national policy and strategic plan for hospices and palliative care in Nigeria, national chemotherapy, safety, called ChemoSafe for short, and also the review of national cancer plan. I must say that Nigeria is one of the very few countries in Africa that have up-to-date national cancer plan. In fact, close to 25 countries in Nigeria in Africa does not have a state national plan. Some their own is updated. Only about 3 or 4 countries in the entire country has up-to-date in the national cancer plan. So we must give that credit to federal government, to the Ministry of Health and the NICRAT. The Nigerian Cancer Society observed with great dismay poor dissemination of information of cancer in the rural community, which considered where most Nigerians live, resulted late presentation and poor access. Most Nigerians live in rural community. You see people do jamboree in city, doing campaign in Abuja, in Lagos, in Port Harcourt, but they will never go to the rural community. And many of them don't even know what they call cancer. I'm from a village in a rural community, and I know that I know what happened at that community level. You go to some community, don't know about something about cancer. I was in my state, in the rural community there in Kogi State, and somebody asked boy, and they call it boy, and where my attention was called to it, I went there, I was called that he has, breast cancer. And I was told that his mother also died with that boy, some years ago. They are calling breast cancer boy. So that situation in the country, that the information dissemination on cancer is not getting to the rural community. And that is why you have both Nigeria, actually deciding. The Nigerian Cancer Society greatly commended, the involvement of some states and private sectors in the diagnosis and treatment of cancer.